do 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 do. Do 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And I'm Laura Diesenhaus, an osteopath and a physiotherapist.
And we're addicted to good health.
So today we'll be talking about severe pelvic pain and menstrual pain. So normally I would be taking a vitamin at this point. We'd see what vitamin Dr. JJ is taking today. But since we're talking about period and menstrual pain, since I do not menstruate, Jen is volunteered to take the vitamin. And in her case, she's taking a high-potency B vitamin, which I found to be very beneficial with women with menstrual pain, PMS, breast tenderness and swelling. Mostly it's due to the vitamin B6 in it, but I find the B vitamins as a whole seem to work very well. Most women, for any kind of hormonal issues, B vitamin, excellent results. Mm-hmm.
So, menstrual pain. A lot of women get it, and it can range from something mild, discomfort, or even severe. You have had some patients that have had severe menstrual pain. I've been fortunate. What are some of the symptoms that they've come to you with?
Basically severe pelvic pain. They've had to take medication for it. They've had to be curled up in a ball for a couple of days. It could be quite severe. Not just in some cases we're talking about, it hurts for an hour, but other people, they're out for a day, 2 days, have to take some time off of work. It could be quite painful.
Mm-hmm. Yeah, same thing. I mean, often people come in, and we're not talking about necessarily the women who, a lot of women the day just before the day of the first day of their period, they get some low back pain, they get some aching in their pelvis. It's really the women who are, have to lie down, are in so much pain, have to take something. That they're the ones we're sort of talking about more in terms of what we're going to be doing today.
So, what causes this type of pain?
Well, usually in the case of really severe menstrual cramping, it's due to too much prostaglandin 2. It's a prostaglandin E2, I believe. It's just too much inflammation, which is why you see, at least from the natural perspective, is why you see things like evening primrose oil seems to really help. In some women, it could be worse if they have uterine fibroids, if they have endometriosis, if there's other issues going on in the pelvis. Probably posturally too. You must have seen a lot of interesting stuff with.
Yeah, in terms of osteopathy, when women have severe pain like that, if it's not specifically hormonally related, and you can clear that up certainly with naturopathic treatment. Sometimes it's just because, for whatever reason, maybe from their own birth process, or if they've had children, the position of the uterus has caused some tightness of the ligaments around it, or there's some scarring. So there can be some mechanical reasons for their pain. And in terms of posture, if women are sitting for long periods of time and not keeping any sort of tone, then some of their abdominal contents get sticky at the bottom, and that causes congestion and pain.
Oh, wow. So what can a woman do to help with menstrual pain?
Well, we talked about B vitamins and evening primrose oil, and Laura osteopathically will.
That's right. With osteopathy, there's osteopathic organ, or what we call visceral manipulation, where you want to go to the abdomen, go to the pelvis, and you assess the different organs, especially the uterus and the ovaries and the small intestines, actually. And you want to feel if they're mobile, if they're moving the way they should, often women have tilted uteruses. Their gynecologist will say, oh, by the way, you have a tilted uterus. And even though it's functioning fine, there's nothing medically wrong with it. But osteopathically, we know that causes tensions in the pelvis that can contribute to congestion and pain. And so there are techniques that we use to relieve the tensions on those structures, and the pain can go away.
Very good. Well, let's see a demonstration then of some of the different procedures.
Okay. So often, now that I've got you in position, Jennifer, often when we're going to initially assess the abdomen and the pelvis to see where to start and see what's restricted, the first place we often look at is the small intestines, or what we refer to in osteopathy as the mesentery, which is just a term for the supportive structures for the small intestines. So to assess them, we put our hands on the tummy, just sort of where they like to sit. And what I'm feeling for is if they have the normal inherent motion that they're supposed to have. There's a rate that they rotate 6 to 12 times a minute. And I'm trying to feel if they move, if there's a drag, they're being pulled to a certain side. And often they are quite tight, and they're actually pulled down and often into the left corner of the pelvis. So the way to release that is I'll come in and I'll cup right under the bottom of the small intestinal package, right? It's a huge series of coils that sort of come together in a clump, I guess you could say. And what I'm trying to do is I'm gathering up the mesentery, the small intestines, to get some tension where I feel they're being dragged down, a fascial tension, and I just wait for release. So it's a pretty gentle technique, but it's very specific, and you're going deep to feel where the tensions are. And I'll work on that for a few minutes. There's different angles you want to get at, and even use the knees a little bit to make sure that those structures that are pulling it perhaps even down into the groin sometimes can be involved. So I release the small intestines in every direction. Then, once I've done that, I'll come back and I want to evaluate, just bring your knees up a little bit further, I want to evaluate the uterus and feel if the uterus is free or tilted. The absolute optimal way to assess a tilted uterus for sure is an internal examination, which I'm not doing. That's done by a gynecologist. But externally, there is a way to feel if there's normal movement and position to a certain degree of accuracy. So I'm going to put my hand on the lower pelvis above her pelvic bone, and I'm also feeling I'm feeling for the position of the uterus, and I'm feeling for tensions. And often, for example, we'll find tensions in one of the main ligaments that supports the uterus on each side, called the broad ligament. So let's say the broad ligament of the uterus on the right side is tight. I can feel that it's getting pulled over. So to release that, there's a simple technique. I'm just going to get you to put your legs down and turn onto your side away from me and come back towards me. Yep, just straighten your legs there, and I'm going to have you lean your hips against me. I'll just put your hand over there. And what you do is you come onto the uterus with the heel of my hand down here, and I'm just putting some pressure, and I'm going to engage the ligament and the tension that I feel coming over to her hip bone here where it attaches, and I just wait and release it that way. And then I would reassess it and see if it's mobile. So those are just some two simple techniques to address some of the things that can go on in the pelvis and the abdomen when there is some severe menstrual pain.
Well, thank you, Laura, for demonstrating the different techniques so someone who has a problem like this will know what to expect at an appointment with an osteopath.
Oh, thank you.
Thanks very much.
Thank you.
Well done, as usual. What are these notes? Well done, well done. So for those of you at home who'd like to find more experienced and well-talented practitioners, such as Laura Diesenhaus over here, please go to www.vitaminjunkies.com, where you'll find a list of practitioners. And also, please join the Addiction and sign up for our weekly podcasts.
And while you're there, take a look in the show notes. You'll find a link to a survey. We want to get to know our viewers, what your interests are, and this will help us plan for future episodes. Plus, if you're from North America and you complete the survey, you will be eligible for an amazing $100 prize pack from Hey Jude. So please share your input with us. Thank you so much for joining us today.
Thank you.
I'm Jennifer Lyle.
I'm Dr. JJ.
I'm Laura Diesenhaus.
And let's continue the addiction to good health.
Do 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 do. Do 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 do. Do do do.